Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account, you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications, which are sometimes overlooked. So overall, we hope that by watching the video diary program, you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
My name's Norman Thompson. I'm 71 years old. I've been in printing all my life and I retired in 2008. And shortly after that, 2010, I was diagnosed with cancer. I'm married, my wife's at home at the moment. I have 2 children, both of them married. And they're living away from home now. One has got 2 children, with a grandparent twice over.
Norman, thanks for coming in and joining us today on this video diary program, Cancer Stories. We haven't met before, but I hear that you've had oesophageal cancer, which is perhaps one of the less common cancers. It's certainly valuable to hear what that involved and how that came about, really. So how was it first picked up in your case?
Well, it's in about year 2008. I had a little problem trying to eat and trying to swallow things particularly, and we realised that something wasn't quite right, even though we were fairly fit and we used to play a lot of tennis, and so we thought that we needed to go and see the doctor. And that's how all this episode started.
Did the doctor refer you to hospital quite quickly, or did they do their own tests for a while?
No, he was very good actually. He got me straight into hospital within a week.
Yeah.
And the tests started from there.
So you went to the hospital, and then what tests did you actually have there?
Well, they did endoscopies, which determined straight away that there was a narrowing in the esophagus.
Yeah.
And they thought it straight away that it was cancer, and more or less fairly quickly after that they determined that it was cancer, and we needed to go for further tests and eventually chemotherapy.
It's always an issue in the medical profession now, how well we deliver sensitive information. How well do you think that process was handled in your case?
In my case, I think it might have been a little bit harsh when we were told almost straight out that you have cancer. And that was quite a bombshell when you feel as though you've been fairly fit over the years. So I think maybe if you'd have seen me then, my bottom lip might have dropped
Yes.
a mile.
It's a difficult time.
Yes, it was quite a shock.
Did you feel that you got the advice and support that you needed from day one?
Maybe not. I think things slowly it dawned upon us what we were going to have to go through. So things were very slow, I think, in picking up in the early stages.
Yes.
Yeah.
And what were the initial steps in terms of planning for your treatment?
It was determined that we were going to need to have chemotherapy, and one or two options were put as to what we were going to need.
Yeah. You had the initial chemotherapy before surgery then?
The chemotherapy went before the surgery to reduce the size of the tumour.
Yes, the tumour load. And how successful was that in your case?
In my case, it was very good. I think actually we may well have caught it in the early days.
Yeah.
There are, I think, I'm told that there are 4 stages in the development of cancer, and stage 1 is rarely seen. Stage 2 is a little bit more common, and I think I was at stage 2, so it's quite an early stage in its development.
Did they give you that information later based on
that came a little bit later on? Yes,
pathology that had come back after testing? Yeah,
that's right.
So you had the chemotherapy. How long was that process roughly for?
That lasted for about a month or thereabouts, a little bit longer perhaps.
And when was this compared to where we are now?
That was in June and July of of 2010.
Okay. So roughly 3 years ago.
Yes.
Yeah.
Yeah.
Okay. And you mentioned there, but how successful was the chemotherapy for you in terms of shrinking that tumour?
It seemed to shrink it quite well. The chemotherapy wasn't particularly nice, and I think everybody experiences the different stages and
side effects
and so forth. And
did you have any particular problems yourself that you stick in your mind?
Yes, there was 2 cycles. The second cycle, I was quite sick. And it did affect me quite a bit.
Yeah.
I'm not very good when I'm sick, but.
Did you have the chemotherapy that meant you had to come into the chemotherapy suite? Or you had the one that you took home?
It meant that I had to come in for 1 day, and then we went home with an attachment in the PICC line, which drip fed in for the 4 week.
Right. Okay. And what was the next step then?
The next stage, they determined after that we were going to have an operation to take out the cancerous part of the esophagus.
And I know from previous experience that often the operation for the esophageal cancer can be quite complex and in-depth.
It is a very complex operation, and 9.5 hours I think mine was, and done in 2 stages. Where they had to reduce the stomach size in the morning part of the operation. In the afternoon part, they have to go in through the ribs on one side, deflate the lung to get at the esophagus, take out the affected part, and then rejoin up the reduced stomach size to what's left of the esophagus. So it's quite a complex operation, and you know a little bit about it for a few days afterwards, or even longer.
Well, in fact, you often go to ITU for the 2 or 3 days, don't you, as an automatic check?
Yes.
And did that happen in your case?
Yes, it did, yes.
And what was the recovery period like on the ward subsequent to that?
It was actually good, and the hospital, Leicester Hospital, was very good in helping out. I don't have any complaints at all with the treatment that we had. It was excellent. How
did you find the degree to which you were encouraged to get up, mobilise, start walking again?
Actually, they were very quick coming round to get you to walk. In fact, the very first day in ITU, I was asked if I'd like to sit out in a chair, and although it took a lot of effort from their point of view in manoeuvring all the tubes and the bottles and the drains and things like that, they found it beneficial that I did it, and I did do it, and I sat out for 2 hours.
Usually when you give yourself a bit of a push as well as them encouraging you, the combination gets you up and moving more quickly than if you just waited for the day you were feeling better.
Yeah, I think that's true.
Yeah. How long were you in hospital in that rehabilitation phase, or the recovery phase I should call it?
I think I was in, mind plays tricks with you after a while. I think I was in there for about 2 to 3 weeks.
Yeah, that sounds about right. And what was it like to finally get home?
Lovely. But hard work. You know, there was a big learning curve once you got home to learn how to cope with the various types of foods and what you'd undergone. And I think you had to learn how to deal with your own body. If you were tired, you went to lay down. If you were fit, you went and did something, perhaps for argument's sake, out in the garden.
So in other words, you were taking feedback from how you felt, and
Yes.
then you would capitalise upon it if you could.
Yes.
But if you needed to rest, you would as well.
I think that's very true.
Yeah.
You've got to learn how to cope with these things, yeah.
You mentioned there about the changes in appetite and eating. I know for almost everyone after that major operation, that's an issue. What were the major changes in your routine in terms of food?
Perhaps one of the biggest ones is you realise that you can't eat quite so much as you used to, and you have to eat a lot less and probably a little bit more often. You know, you have to graze, I think, is the term which a lot of people use.
Yes.
You know, just picking as you go through the kitchen, and you pick something up and eat it, and you know, so it's not 3 meals a day. You eat a lot more, but smaller meals.
Is that because the stomach capacity is
Yeah.
reduced?
Yeah, you've got a lot smaller stomach.
And also the type of foodstuffs, is that affected?
Yes, I think to a limited extent, yes, the type of foods had to be adjusted. Yeah.
In which way? What about the solid constituents of harder to chew foods, or was it something else?
Initially, I think it was probably a little bit more liquid type foods
Yeah.
until you got onto more solid types.
And was there a dietitian to advise you,
Yes.
or did you do it yourself?
No, there is a dietitian, qualified dietitian, who advises you what to eat and how to eat,
Oh,
and
that's good.
types of food to eat. Very, very good advice coming from
Brilliant.
the hospital itself. Yeah.
And what was happening to your weight over this time?
That is one of the things they try to do, is to keep your weight stable and not lose too much. In my case, I didn't lose too much weight, so I was quite fortunate. But if you do it can become quite a problem in due course.
Were you watching out for that yourself specifically?
Not particularly, no. It's just that I managed to maintain my weight, which is, you know, quite fortunate.
Was that because you were able to eat most things that you put your mind to?
Yes. Yeah.
Did you ever need those food supplements that are common these days?
No, I didn't particularly, but there are a lot available, and no, I didn't particularly need them, and sort of managed to cope with what we could, you know, normal foods.
So what was the next big step for you?
Playing tennis. It was a big step, actually, because about 3.5 months down the line, I first went onto the tennis court, and that was an absolute boost.
Were you previously a keen tennis player?
Oh yes.
Yeah.
Yes, but it was a real boost to get back on a tennis court and realise that you can hold a racket and swing a racket and, you know, serve a game, because, you know, when you realise that your muscles around your chest have been cut, plus all the other things that have gone on, you realise that there could have been a difficulty there, but there's not.
What was your game like compared to previously?
Not too bad at all, actually, but obviously in subsequent times in the last couple of years, it's I've probably played meaner tennis than I've played all my life. It's
Really?
very strange, really.
It's changed your attitude or something else?
Not particularly, no, but I just seem to be playing better tennis. Very odd.
Maybe you've been playing more games in a shorter period.
Yes, it might be that, I think. Yes.
Yeah. So your game's naturally improving anyway.
Yes.
Even at this stage. Do you
Yeah.
play more singles or doubles?
It's all doubles.
Yeah.
Don't play singles at all.
No, it's hard work singles. Isn't it?
Singles is hard work, you know, particularly when you've had an operation like this. Yeah.
Sure, that's fair enough. So you had that big step of taking up that big activity, and that's symbolic to me of you being able to do a lot. You know, if you could play tennis, that tells me you could probably do most things.
Yes.
So were there other activities that you were beginning to redo at that stage?
Well, I think in between coming out of hospital and playing tennis, I used to deliberately go out for walks to get body strength back. And even subsequent to playing tennis, we still did them both, you know, the walks as well. So,
given that you were actually doing a form of exercise from a relatively early stage, nowadays there's a big interest in the cancer community of actually prescribing exercise as a form of treatment for people who are beginning their rehabilitation.
Yeah.
Whereas in the very distant past, we used to prescribe rest, basically.
Yeah.
We're now prescribing exercise. Would you say that was a rational and helpful thing to do?
I think it's quite useful. I mean, I'm not a medical person, but probably it gets the endorphins going and the mental state of a person to actually be able to do a sport of any type or activity of any type.
Yeah.
It's got to be good, I think.
I'm interested to hear what helped you on your recovery, particularly what support you had during that recovery period. What was valuable for you in that time?
I have a very useful asset in a wife which was very good at helping out. We were talking a little bit earlier about those who haven't got any people to sort of look after them at home, how they would cope.
Yeah.
I seem to get on very well because my wife helped an awful lot in the difficulties that we went through.
She was closely involved.
Oh yes.
And was she retired at the time?
She's retired, yes.
Yeah. What did you find was particularly valuable compared to not having her around, if that makes sense? What did you really value from her?
She has a little bit of a medical background, so that's quite useful in knowing the various stages of body functions and things like that. That is extremely useful.
Yes.
Which not everybody, even with wives and partners and so forth, would have that sort of benefit.
She had special expertise.
Yeah.
What did she used to do then?
She was a radiographer.
Oh, that's very, very good, because their training can include a lot of medical areas.
Yeah.
What did you find was the reaction of friends and distant family?
That's a difficult thing to quantify. I think when I was first diagnosed, it was quite a shock. Mainly because my personal difficulties. My sister, only two months beforehand, she died of pancreatic cancer.
Gosh.
And whilst I was in hospital having my operation, my mother was in hospital also with bowel cancer.
Oh, I'm sorry.
And she passed away actually while I was in hospital. So it was a fraught time for the whole of the family.
You had a lot to contend with.
Yes, it was quite difficult. One of the first things we had to do when we came out of hospital was to bury my mother. You know, the funeral service for that. Yeah, so it was quite a difficult time, that was.
Were you able to be around for them? I know you were unwell at the time, but were you able to be around to some extent?
Yes, for my sister, because that was before I was diagnosed. Not so much for my mother. My wife had to do nearly all of the arrangements and visiting for my mother. So
that's very difficult, isn't it? You've had experience then in the family of these three different cancers,
yes.
The pancreatic cancer,
yes.
the bowel cancer and the esophageal cancer. What's your opinion about how medical care is organised for these three areas?
That is difficult to quantify. I can only go on a personal experience, which I found excellent, really good.
Yeah.
In Leicester, I can't answer for other towns, but Leicester's been extremely good to help people through in the hospitals and the aftercare as well.
And your sister who had the pancreatic cancer, that's one that, again, is a less common cancer, but it's one that can advance quite quickly.
Yes, it did.
What were the main symptoms, if I can ask that?
I think pain as much as anything else.
Yeah.
Again, not having had that, it's difficult for me to actually specify, but pain, I think, is mostly.
You were seeing it secondhand in a way.
Yeah.
And do you feel that she had, appropriate treatment at the time she was unwell?
Yeah, she had good treatment.
Yeah.
But with pancreatic cancer, there's not a great deal that they can do, I don't think.
How long was she living with that condition?
About 1 year. Probably slightly longer, but not a great deal from diagnosis.
Okay. Let's come back to your situation, because I was talking about the recovery period, which goes into a kind of rehabilitation period. And I was talking about the reaction of friends. Were there any other source of support that were valuable during your rehabilitation period?
Not particularly that I can think of.
Anything from the hospital or professionals that were involved?
Yes, from the hospital's point of view, yes, there's very good support via the specialist nurse and the specialist dietician.
Yes.
There's certainly those two elements there. If there are difficulties, we found that they're only a phone call away.
That's very good.
And for example, we have picked the phone up once or twice with a particular difficulty, and they've helped enormously.
Yes.
Yeah.
Have there been any setbacks or complications along the way during your rehabilitation and recovery?
Actually, not over much following the original operation, but certainly in the last year, or actually just before that, when we were diagnosed with gallbladder problem, we were going to have the gallbladder out. That actually took place in Easter of this year. That's 2013, of course.
Yeah.
That was done by keyhole surgery, not too difficult at all, but the only problem with that was that shortly afterwards we had an infection which had to be drained.
Okay.
That almost came straight afterwards. Subsequent to that, almost immediately, we had continuing problems with trying to eat, where it was thought that the cancer of the esophagus might have come back.
I see.
Although having just had the gallbladder problems out, they were all, I think, looking at that it might have been a problem with that, until they did further tests and realised that there was a restriction in the stomach area where it met the duodenum.
Yes.
Okay.
And what did it turn out to be then, or has that not been answered yet?
Well, strangely enough, it's not actually been diagnosed. They anticipated that it might have been a recurrence of cancer. And when they did an endoscopy, there was no sign of any change there. So they thought that there might have been a cancer on the outside of the area where the restriction was. And so we had a CT scan that made a comparison with one which was done sort of 3 months beforehand.
I see.
And there was absolutely no difference at all. So they realised that there wasn't, or at least it doesn't seem, that cancer has reappeared.
Well, that's good news. Although it would be nice to get an answer what is going on.
Yes, I'm a bit of an enigma because they don't know.
What problem is it causing regarding your lifestyle, stroke, eating at the moment?
Right, well, because there was a restriction, food wasn't going through at all, and we were actually losing weight quite rapidly. And we had to have, what's it called, PNT?
A peg feed?
Parental feed.
Parental, with the intravenous?
Intravenous, yeah.
Yeah.
For 2 weeks.
Yeah.
And that was followed by an operation where they were hoping to do a Roux-en-Y bypass operation. And then they realised that they weren't able to do that because of the reconfiguration of the original operation back in October 2010.
Yes.
So the next best thing was to put a stent in to open up a gap so that it allow for the passage of food.
And that's what they've done?
That's what they've done, yeah.
And has it alleviated your symptoms?
It's alleviated the symptoms in as much as we can now eat, although with difficulty with certain types of food. So it's quite, I imagine it's quite a rare condition that we're in, position that we're in now.
It's very anxiety provoking when you have a new symptom which could be a recurrence of the cancer.
Yes.
How do you manage that worry in a way?
It was a worry to start off with until we were told that it wasn't a recurrence.
Yes.
But then we've got to relearn, I think, all the eating habits that we'd forgotten about from the original,
Exactly. You have to restart with a more restrictive pattern.
Yes. Yes.
But do you have any methods, coping styles or advice regarding managing in an uncertain situation?
I don't know. That's a difficult question, I think.
It is difficult, yes.
Yeah.
And what I'm really asking is, do you have a way of getting through things when things get difficult like this?
Do I have a way of getting through things? I'm a philosophical person. Yes,
Yes.
you get through somehow. You work your way through things. Yeah, sometimes with a little bit of difficulty.
Where has that left you at the moment, and particularly regarding your view of the future now? Are you able to make plans as normal, or do you feel somewhat restricted right now?
Well, it's early days yet. Since it's only 2 months since we had this stent fitted.
Yes, quite
So
recent.
it's quite early days. We're sort of having to sort of learn again what types of food we can eat and can't eat.
Yeah.
Because obviously certain types of food are liable to catch on this wire cage stent.
Fair enough.
And it can block up again. And it wouldn't be the first time that we've been walking around the playing fields just in front of the house at midnight trying to free the blockage that's been caused. And generally speaking, it's been quite successful. Yeah.
Are you thinking about the longer term future at the moment?
No, I'm not particularly, no, but I think we have got to learn to, live life to the full. That's what it's all about.
Yes.
And we're certainly intending to have more holidays and holidays abroad or whatever we can manage.
Definitely.
Muster up.
How do you think the diagnosis, the treatment, and then the recovery complications, the slight setback, how has it changed you as a person compared to how you used to be? Again,
that's a difficult question. I mean, like I say, I'm a person that sort of takes things as they come, and then you work your way through the difficulties. So it's not a life changer as such, but you do have to sort of live with it. And
let me ask you that in a different way.
Right, on it.
Do you feel back to the person you were before the cancer was diagnosed?
No, I don't think you ever do. No, you realise that you've gone through a life-changing experience.
Yes.
And you do change your life accordingly. Yeah,
definitely. And how do you think it's affected the family particularly?
The family are very good. That they, because my son is in medicine anyway. He works in theatres, so he knows what's going on.
Yeah.
Perhaps I know a little bit too much at times.
Sure, that can be the case. Yeah.
Yeah, but yes, he's quite supportive in helping out in things. Yeah.
Has it caused a significant change in your daily routines?
Yes, to a limited extent. You have to learn to do things that accommodate your own experiences, of life with cancer or having had cancer. Yes, it has caused certain ways of dealing with things, and even now you sort of get days when you're not feeling too good, and you have to just ease off, and cope with it.
Yeah. And
then other days when you're on top of the world and you get on with things. The gardening or whatever, I get plenty of those actually. Yeah.
I'm thinking now about other resources that might be available, and some patients have mentioned to me the value of meeting other patients and getting specific support from them, either one-to-one or in a group format. Have you had that opportunity?
Yes, we have actually. There is now a patient support group meeting for esophageal cancer patients, and I found it quite useful, not from myself particularly, but for helping other people with the same condition. I found it's very good for helping other people, because there are people who are finding it difficult, and their conditions are different perhaps to mine, but they need some help, and being able to talk things through. How I've coped with it and so forth. It's been very good, I think, from that point of view, that patient support group meeting.
Have you been able to help other patients specifically?
Oh yes.
In their journey?
Oh yes.
Yeah.
Yes, and I've received, in fairness, I've received help from other people, certainly early on. So it is good to be able to talk about these things. It is a condition, esophageal cancer, that's, like you said earlier on, it is not common, and for 6 months I don't think I'd met anybody else with that condition, but when I did, then it was such a relief to be able to talk to somebody who's had the same condition. It was a relief for me particularly, because it was, I'd never spoken to anybody before about it. So,
do you think we should, in the healthcare system, organise this kind of, we sometimes call it peer support, support from other patients throughout each centre and each setting, every type of cancer, even other conditions?
Yes, I think it is quite a useful idea. One of the difficulties may be that if you're having a one-to-one session with people, is that you can start to relate your own personal circumstances to that person, and that might not be helpful. You're there to help the person through their difficulties, and you've got to get the right type of person to be able to help them through, I think.
Yeah.
There is a difficulty there that, you're talking about your own personal difficulties. That can't be good, I don't think, particularly.
Is it difficult to see patients in a more advanced stage, or do you personally manage that?
I don't know whether you can ask that one again,
Yes.
that question again.
Do you want me to still ask that question about seeing people whose cancer is more advanced than yours, like a later stage? Is it difficult, to relate to those? Do you prefer to, I don't know, some people say they don't want to hear about people in a later stage.
I'm quite willing to help people in the later stage. I don't know whether I might find it a little bit difficult. My wife's actually very good with communicating to people who've gone through a more difficult condition than I have.
It seems you've made quite a lot of progress already. I know you've had a setback and those symptoms were troubling, but they've been managed to some extent. I know you're not totally free of those problems right now, but still it seems like things are progressing forward. Where do you see things going in the future from here?
Well, I don't have any sort of great ambitions. There are lots of things to enjoy in life. Quite local, you're in your own gardening, your flowers, your birds that are around. Actually, I quite enjoy going fishing, which I do, so that's an activity which one can entertain. So there's lots of things in life to enjoy, I think, without sort of being over ambitious. Obviously holidays are one of those things that you can highlight as being encouraging for the year.
It sounds actually like you've got quite a lot of things you enjoy these days.
Yes.
Do you think that you're held back, if you like, by anything in particular right now?
No, I don't think I'm actually held back in anything, so pretty well do what I'd like to do. That's quite a good thing, in life.
And how far through the rehabilitation period do you think you are, in a sense of, from being really unwell just after the operation to now? How much further do you think you could go in terms of improvement?
I think I'm as far as I can go, actually.
Yeah.
I've done pretty well over the years, and it's a jolly good encouragement, and hopefully it is to other people that you can come through these things.
Definitely, that's what I think a lot of people will be interested to hear.
Right.
And how long is it now, to summarise, from the operation until now? Did you mention it earlier, 3 years?
It's October 2010, we're nearly in October 2013, so it's nearly 3 years.
So in that 3-year period, you've got back, to quite a high degree of function.
Oh, yes.
Are you satisfied with the progress you've made?
Oh, I'm very satisfied.
Yeah.
I don't think everything's going to be quite the same as it was. You can't expect that, but yes, I'm quite happy with things how things have developed over the recent months and years.
That's excellent. And I just wonder if you think about some of the big questions in life now. I know really a lot of people with cancer are bound to think about their own mortality and what might happen. What's your thought on that?
On mortality, sooner or later you're going to die. I think you always realise that. It's a question of making the most out of the days that you got, you know, before you, and doing what you can, enjoying what you can, and enjoying life. You know, sooner or later you're going to die regardless, but you know, you've got to look on the positive side for these things.
And it sounds like to me you're doing that despite these setbacks, and you know, the fact that you've doing all those activities that you mentioned, and you're really aiming to do positive things in your life. That will give other people an inspiration as well, that they can do it too. If they're at an earlier stage and that they want to follow in your tracks, there's no reason they can't do it as well.
Yeah, there isn't any reason why people shouldn't be positive in their own way and do work out their own way of living, you know, looking at it very positively.
Exactly. So I want to thank you for coming in today. Thanks for sharing your story.
It's quite a pleasure.
You've got a lot of valuable insights that people will appreciate. So thanks again and take care.
Yeah, thank you very much.